This program is brought to you in association with First National Bank of Botswana.
FNB, how can we help you?
Just as when the whole world thought that we'd be catching a break from COVID-19, in came the Omicron variant, which is another one of the many subtypes of the virus. Things took a turn towards the end of 2021 when new COVID-19 cases across the globe just started rising alarmingly. Although not as deadly as the Delta, Omicron is undeniably more transmittable. The rate of transmission was so high that it forced some governments such as Canada, Australia and the United Kingdom to go back into lockdown. This had such an impact on the global economy, so much so, the International Monetary Fund had to revise growth prospects down from a stellar 4.9%. Even though there is information trickling in about this new variant and the number of new cases also declining, there are still some pockets of disinformation, misinformation, underinformation, and in some instances, a general misunderstanding within the public about the behavior of this new variant and the consequences of contracting it. As such, we have invited onto the program Dr. Kiran Bhagat to share his insights as a medical professional. Doctor, thank you so much for coming on First Issues and affording us your time. We're here to get the latest updates on the COVID-19 pandemic. So my first question to you is, what is the latest information coming out as regards the Omicron variant that started, causing havoc late last year?
Things change, week by week, and since we last talked before Christmas, many developments have occurred. And as you remember, towards the end of last year, everybody was throwing accusations at Botswana and South Africa for hiding information and the source of Omicron, only to discover that within literally a couple of weeks, the entire globe was infected with Omicron, and most of Delta infections that I'm sure the public are aware of have largely now become unrecordable. And the good news about, let's start with the good news. The good news is, looking at the South African data, is that the majority of the Omicron that swept through South Africa was largely mild. We believe that the largely mild response in South Africa was probably because of the low vaccine uptake, and also that many people in South Africa already had a Delta or another variation of COVID as a result, having already immunity that sustained them against the Omicron wave. The second issue we've discovered with Omicron, which people are now treating as almost like a cold, and then some people call it the Omi-cold, is that it seems to infect us differently, almost as if it's like a flu. It tends to not get into the chest, which is why we've had fewer hospital admissions. It tends to remain within the mucous membranes of the upper parts of your body. So you have a running nose, you have sneezing, and you have a tickle in the throat, classical flu-like symptoms, for which the majority of people don't go into a hospital, thankfully. So our hospitals have not been overloaded over the last couple of months, and we've seen a rapid reduction in the incidence of COVID-related admissions as a result of Omicron. In addition, what we found is pretty much like flu. The Omicron variant appears to be very, very different from the Delta and the Alpha and previous variations. In fact, it has changed almost 50 times fold in terms of the way we look at it under a microscope. It has had 50 different types of mutation on the outer aspect of the virus called the spike protein, such that some of the earlier vaccines that we used seem to produce less effectiveness. They certainly do work in reducing hospital admissions, and at this point it's important because there is increasing unease amongst some of those who've not taken the vaccine that, Naka, I've taken the vaccine and I still got COVID, or I don't want to take the vaccine because it doesn't seem to protect. It's very important for people to understand that the vaccinations are there not as a guarantee that you will not get infected, but if you do, it's a mild infection. The purpose of the vaccinations worldwide is to ensure that what we saw in 2019, 2020 and the middle of last year was our health system was overloaded. We were creating extra beds, we were creating tents to manage our COVID-related chest infections. The ICUs were blocked. This is primarily what we're trying to do, and the vaccines have clearly demonstrated that we've had a rapid reduction in hospital admissions. And so in that sense, Omicron has been, if you like, the great equalizer. It is something that, in 2/3 of the world, the global south, as we call it, those that have not been able to afford the vaccine rollout programs as in the north and the richer countries, this Omicron has provided a mild infection and some form of immunity. Public scientists and as well as virologists are now debating as to whether this really is almost like giving yourself a booster. If you had the first two vaccinations and you've had Omicron, it appears that your immunity does rise. And so there's debate amongst the scientists, the CDC in the United States as well as the Europeans, as to the value of further vaccination once you've had the Omicron. So we do know that people are slightly letting their guard down in terms of Omicron and its prevalence. And certainly in Botswana, we see very little hospital admissions, very few hospital cases. And the ones we do see are the ones that we've talked about last year when Delta was prevalent, those with chronic diseases, those children who have immune deficiencies, those who are asthmatic, and particularly the obese. We find interesting data in the last 12 weeks where those that have repeated COVID infections are particularly the obese patients, because it appears that the virus can actually hide in your fat cells and then reactivate again if you have another exposure. So diabetes, blood pressure, obesity, cancer, immunosuppression are the ones that we are concerned about that we do see in the hospitals.
I want us now to go back to the issue of getting vaccinated, after you've gotten Omicron. With this variant being so highly infectious, I wanted to come out clear, from you, if we still need to get a third jab or a booster after getting infected by the Omicron variant.
There is a big debate, Pononsego, and the debate is currently raging both in North America and in Europe and amongst the South Africans. In the global south, our principal concern is we need to shore up those that really need the vaccination. In other words, those over the age of 40, those that are particularly the elderly who need an immune booster because their immune system is compromised, and those that have chronic conditions which predispose them towards a waning of the double dose vaccines that we had last year. So the principal concern amongst the South Africans, and I think it should be ours as well, that let's make sure that those that really need the vaccine are vaccinated not only doubly but triple, if, in other words, a booster if they need it. Those that we see now that have had Omicron, and we do test in the laboratory the levels of immunity by something called an antibody level, it appears that we become very quickly immune to Omicron. We produce a good response. And scientists are studying whether the younger population, particularly the teenagers and those who are well between the ages of 25 and maybe 40, should be taking a booster or not. And I think we need to follow the guidelines at present that indicate that most should have the booster. But the debate is raging in terms of children, particularly between the ages of 5 and 12, and the 12 to 18-year-olds as to what they really should have. Because most of these children, given the nature of what children do, are getting themselves infected in their play, and when they wear their masks, I've seen some children biting their masks and playing with their masks. So the effectiveness of some of the mitigation measures we used last year have not been as evidence-based, and so all of this is coming out. It's important to say also, for those out there who are vaccine skeptics and suddenly also scientist skeptic, is that science is by nature not a truth. It's a process of change. So when scientists say this week that we recommend masks, and then a couple of months later we say masks are not effective, it's because the science has changed. Some members of the public use it as the ability to point a finger to say, the scientists don't know what they're talking about. But science, as a result, is in its very nature changeable, because we're looking at the data, we're looking how it's changed, and things, we are in 2022 way ahead in the last 2 years compared to what we were in 2019 when we locked down. The availability of drugs, mitigation measures, vaccines, our understanding of the virus and how it changes has vastly improved our arsenal of protective, preventive and curative methods.
Still on the issue of vaccinations, there's just so much information, misinformation and disinformation regarding getting vaccinated whilst pregnant. So I want you to, give some clarifying information on the data that is supporting getting vaccinated while one is expectant.
There is no doubt that getting COVID during pregnancy is far greater risk than getting the vaccination. And I know that there is hesitancy amongst those who are pregnant who have not been vaccinated to receive the vaccine. But the data coming out from Israel, from North America, as well as the UK shows that it is effective, it is safe, and it reduces your chance of having COVID-related complications either to the mother or to the baby. So those that are out there that are pregnant, that have not been vaccinated, please do vaccinate, because the data is very persuasive. The data comes largely from studies that were initiated using particularly the RNA vaccines such as Moderna and Pfizer, where people were put into trials to look at the effectiveness. Women were put into these trials looking for the effectiveness of the vaccine in women, and these women took the vaccine and then happened to find out that they are pregnant. And so they were followed up to see what happens during their pregnancy compared to those that were not vaccinated. And we see COVID-related complications occur, particularly if you're an elderly mother, or if you're a mother who's diabetic or has blood pressure or is overweight or have chronic conditions. These are the pre-existing factors that put you at risk ordinarily without COVID. So with COVID, you're just adding more fuel to the fire. So it's very important for people to understand that all organizations internationally, particularly the WHO, do recommend and underscore and validate the safety of the vaccines.
We're almost into our third year living with the coronavirus. So I want you to give in detail some of the behavioral challenges that we've been seeing coming out, as regards fear, anxiety, even guilt.
I think the social determinants of what has happened during COVID are enormous and far-reaching, and because it's a softer science, we can't actually measure the amount of depression or the amount of anxiety. But what we can measure is the number of hospital cases of attempted suicide or depression or sleeping pills or abuse of substances such as alcohol and tobacco. And internationally, there's no doubt that there has been an increasing amount of social isolation, generalized anxiety, particularly amongst children who, when they're young, need to go out and play. Their social skills are gathered by meeting each other, seeing you on face. The Americans have demonstrated that over the last 2 or 3 years, there's been a substantial decline in what we term emotional intelligence in children, because they're not able to see a teacher's face. They're not able to gauge and interact with their other peers because of the lack of, because of masking, because of staying home and locked down. And we know that, those that particularly, I call them the Uber generation, those who are able to afford home online education, which the majority of us in this country are not. We see those that have learnt online have not learnt as effectively as a one-to-one or in a classroom. So from the perspective of children as well as adults, I think the implications are vast. The stigma previously of having had COVID now is slowly disappearing, because, as I say, Omicron is the great equalizer. Everybody gets Omicron, it's so contagious. So, whereas before you were accused of getting COVID because you didn't mask, or maybe you didn't take the vaccine, or you didn't isolate. This has now actually been thrown into the waste bin, because Omicron gets you however you like. And so it's important to understand that the psychologists and the therapists are looking out there in terms of the impact of this internationally at an emotional and psychosocial level.
This has been going on for so long now, and one can only wonder if the horizon will ever be positive. Are we ever going to see an end to all of this?
I think what's important to understand is in most parts of the world, even those that introduced severe lockdowns, such as Australia, New Zealand, Canada, are now beginning to understand that there is COVID fatigue amongst the public, and the second is that we need to learn now to live with COVID. In that sense, what does it mean? It means that we need to accept that the virus is going to be around just like flu. It's going to be something that people get, and we need to protect ourselves. We need to reintroduce public health measures that we did with older infections. If somebody had chickenpox, they stayed at home. If somebody had measles, you ensure that they were isolated. If somebody has a bad flu, you give them paid sick leave. So I think, regulations, public health institutions are now going to have to revisit the idea of having to learn to live with COVID. I think the ability for us to introduce cheaper rapid home testing kits will also be important, so that, when we do go out, as our regulations internationally have changed, where people coming into Botswana need only to demonstrate that they're fully vaccinated rather than have a PCR COVID test when they come to Botswana, is one of the introductory measures that I'm sure we will see in the future, where our nation as well as our neighbors realize that we learn to live with this thing. And so, for example, if you're going out with your children to a restaurant, you need to make sure it's well ventilated. If you can sit outside, make sure that it's not overcrowded. If you're going to museums or to cinemas, make sure you're not in a closed space. If you're going to a pub or a nightclub, you need to make sure you take precautions. You need to test before you go out if possible, and you test afterwards. So these are the new guidelines that will be introduced as we learn to live and to fly and to travel with COVID. And I think that's the way forward. So to put it to bed, because most of my patients do ask me, Naka, when is it going to end? I think it's not going to end, but I think we're turning the page in terms of how we manage it. Moreover, I think it's important to understand, like we said earlier, Ponanseko, that we have this artillery with us, the preventive measures in terms of the masking, and we ought to talk about what masks are and how to wear them. We know now what home measures to do. We know, for example, if you gargle with salt water, it actually disinfects the upper throat. We know also if there's a lot of ventilation in a space, ventilation is the key. We know Omicron is not transmitted by surfaces. It's more an airborne thing. So, coughs and colds, etc., are something that you need to make sure that you protect others. We know vaccines are preventative against hospital admissions. We know now that there are very many drugs at our arsenal. Steroids for those that are admitted in the ICU, inhalers for those that have had COVID infection and chest complications, and the new drugs that are on the market developed by companies such as Pfizer and Merck are very exciting in terms of therapeutics. If you have an active COVID infection, these are drugs that are going to be available in Botswana very soon. So if somebody is admitted with an active, very severe COVID, we have things that we can actually give in the hospital as well as at home to say this is how you manage it as well.